Hello, I'm Bethany Scher, the Director of Government Relations and General Counsel for the Medical Association of Georgia. I'm going to talk a little bit about what happened in the 2022 legislative session, which began on January 10th, 2022 and ended on April 4th or 5th, depending on how you want to say it, at 12:20 in the morning. So MAG is really happy with the way we ended up. There was a lot of different pieces of legislation that went through, and we just thought we might give you a little update. One of the major pieces of legislation that happened this session was HB 1013. It was brought to us by the Speaker of the House, David Ralston, out of Blue Ridge. This bill contained a lot of different provisions aimed at increasing access to mental health care in Georgia. Georgia lags behind most other states in terms of our access to the care that patients who are suffering from mental health conditions and substance abuse need in order to live full and productive lives. One of the biggest parts of this legislation from the MAG perspective was mental health parity. Mental health parity is part of a federal law that actually passed in 2008, and that law requires insurers to treat mental health care the same as they do physical and other types of health care. So whatever the kind of things that feed into your costs or the coverage determinations have to be the same for those two types of care. House Bill 752 by Representative Sharon Cooper brought us the Psychiatric Advance Directive. That is a form that we have been working on for about 14 years in Georgia, and it looks to give patients the ability to put their preferences and the things that work for them in terms of mental health care and substance use care into a writing, and it also allows them to select a mental health care agent similar to the health care agent that you choose under an advance directive. Senate Bill 403, brought by Senator Ben Watson, a physician out of Savannah, is related to co-responder programs. These programs pair a law enforcement official with a mental health professional or substance use professional. This allows them to better respond to instances where a mental health crisis is involved in whatever the incident is. Senate Bill 341 by Senator Kay Kirkpatrick, who is also a physician out of Marietta, would streamline the prior authorization process for patients who are on maintenance medications who have chronic illnesses or conditions. Senate Bill 338 by another physician legislator, Senator Dean Burke out of Bainbridge, Georgia, would expand Medicaid coverage postpartum from 6 months to 12 months. That money was also included in the budget for this year. So all 5 of those bills that we just discussed passed this session. And then one thing that didn't pass that MAG was tracking was a number of measures aimed at expanding scope of practice. So we had a lot of different ideas kind of swirling around the Capitol as we went through this legislative session. That included expansion of scope of practice for CRNAs or nurse anesthetists to kind of full independent practice. We also saw some revival of some ideas that were discussed last year, including prescribing of Schedule II drugs and home health plan sign-offs by APRNs and PAs, and then a bill that also aimed at looking to license pathologist assistants that could have paved the way for some kind of scope expansion for that demographic. For more information about these bills and others, please visit mag.org/advocacy, and we want to thank all of the physicians out there in Georgia for all you do every day for your patients across Georgia.